again, we're experiencing the part of the Delta wave now. And so things are a little different, right? And as we continue to each week go through this process, you know, each wave we've been through has been different, and we continue to adapt, and we continue to look at what the information and the data shows us, and then we look at what our options are. And so certainly what we've learned, if you remember what it was like of spring of 2020, when we were shutting down a society, really because we didn't know how this virus would play out. And then we had to work to restart an economy, and you went through these phases. We learned a lot in that process, and we applied those lessons to really what was our most challenging public health wave, which was the second wave, where we saw cases increase hundreds of percentage points. We saw hospitalizations really get to the point where we were in trouble, ICU beds, and loss of life. But we, at the same time, all of that was happening and how horrible that was, we kept society going, and we learned how to do that. And now, after the vaccination process really happened and continues to happen, here we are. And so one of the lessons we learned was how critical in-person learning was. And I know in times of COVID and pandemics, we get very focused in on what's happening related to COVID. But public health is so much more than just COVID. We have to look at all the impacts of that, and that mental health was something that we certainly saw, certainly the addiction issues, suicides, 911 calls related to mental health doubling year over year. These are all impacts of this. These are all impacts of isolation. So we know how critical it is to continue in-person learning. And so when we look at, from a policy making standpoint, what can we do with a virus in the middle of a surge to have an impact to keep that happening, we've identified some measures. So this morning I signed an executive order making it mandatory in every school district to either have vaccination proof of all interfacing employees in schools or test on a weekly basis. So that is all faculty, that is any third-party vendors that are in the buildings that contract. So we will have a vax or test policy with every school district in Onondaga County. Again, a couple reasons here. One, what we know now with the vaccine, the reason why our community, although being challenged by Delta, isn't being overrun by Delta right now compared to other communities, that is because of our vaccination rates. It's proven that it helps prevent you from getting the virus, and in addition to that, it helps you from keeping out of the hospital and even worst case scenarios. So we want to encourage the vaccine for everybody, but if for whatever reason you're not, we can't take the risk of the virus getting into these buildings. This is too critical, and for our children under 12, they haven't had the opportunity to get a vaccine shot yet. So this has always been about preserving our medical infrastructure and treating our sick, not just for COVID, but for the broader community. And it's always been about specifically protecting our most vulnerable, which are our seniors and our children and our immunocompromised. In addition to that, we'll be mandating mask coverings for daycare providers in Onondaga County under the same premise that the clientele at these facilities are kids, most likely in the age demographics that haven't had the ability to get the vaccine. So we'll be doing that. In addition to that, I know there's a lot of anxiety related to the New York State Fair and then school starting right after. I feel this in my inbox and on social media. We will be doing a back-to-school testing for all faculty. We're working through those, building up that infrastructure to do that, but we're going to put a layer of mitigation with the faculty and staff going back to school, getting a test, whether you're vaccinated or unvaccinated. And again, we expect cooperation from all of our partners. If we have to mandate that, we will. But certainly, these are all things that we can do. These are all things where we have the infrastructure and the ability to certainly enforce, and so we're comfortable doing that based off of the data. I just want to kind of, again, and then I'm going to ask Dr. Gupta to speak specifically about some of the vaccination information out in the week related to third shots for immunocompromised and the difference between that and a booster, which hopefully we'll be able to give out in short order as well. But every time we go through this, everything changes a little bit. And I know there is kind of a built-in metrics that really meant something in each phase, but it all changes. And again, you know, I know positive rates, you've heard me say this and I'll reiterate it. In 2 or 3 weeks, I'm going to promise you our positive rate will be under 1%, because we'll be having 10,000 tests almost a day being done at Syracuse University, right? And these will all be vaccinated students. Does that mean the risk in our community is under 1%? No, it doesn't. Just like when you're just testing sick people every day, which we are, you're going to have elevated positive rates. So the positive rate is not the best metric in this game anymore. And that's not what we look at to make mitigation decisions. We look at contact tracing, we look at hospitalizations, we look at ICUs. Dr. Gupta provides us with various curves. We look where we can, if we're going to have mandates, where we can actually enforce them. Because once you have a mandate, there's an expectation from all of you that it's going to be enforced. So that's what we do. And we look at, with the mitigation that's being proposed, can it change the trajectory of what is a virus in the middle of a wave? And that's how we make decisions. But a positive rate that's just testing 1,000 sick people on one day, if you have symptoms of COVID, there's a good chance you have it. And that positive rate's going to be a lot lower very soon, because we're going to be testing a lot of people who don't have COVID. Does that mean that COVID's less of a threat? No, it doesn't. So we just need to keep things in perspective overall. This is all about hospitalizations and ICU capacity to treat our sick. It's all about the vaccine to make sure that as many people don't get sick. It's all about protecting these subsets of our population who we know if they do get sick are going to have a bad outcome. And for everybody else, we need to be smart, right? With elevated cases, people really should be wearing masks when they're going indoors in gatherings. This is something that, this is being smart. You shouldn't need the government to tell you that. And so, saying that, I'm going to ask Dr. Gupta to shed. I think there's some confusion related to what shots have been approved for a third shot and what has not been approved yet. And we'll come out later this week with some more specifics as to our strategy to get the third shot to the immunocompromised. But at this point, I'll ask Dr. Gupta to come up and shed a little bit of light on that. Thank you, Doctor.
Good morning. I hope you all are doing well. I see everybody masked, which is good. So as County Executive has highlighted it so well in terms of that, we have come a long way from last year. If you remember last year, we were all vaccinated. We were doing case investigation, contact tracing. We didn't have no vaccine at that time. We were still struggling. People were dying, significantly higher numbers throughout the United States, including in our county. Since then, a lot of change. And on June 27th, we had one case. Unfortunately, it went up again because we got tired, but virus did not get tired. It changed its shape and it's changed its style, and it became more virulent. 2 to 3 times more contagious and much more powerful in causing the disease in our body. So we really need to change the strategy, and as you saw that indoor masking came back into the picture, it was not something that people just changed, because the virus taught us how to reorganize our thoughts and bring something back which actually worked. So one of those things, as we are going into, whether it's a third shot or the booster, which I will talk about in a few minutes, is the tools which we had in our toolkit last year. We do not need to abandon them. That is so important. Hand washing, physical distancing, mask indoors. If you don't know those people, if you are around in a grocery store, please put this on. That is so important, because if we have learned anything, even among vaccinated people, people have gotten infection. You saw the case study in Barnstable County in Massachusetts, that there are so many people with the high rate of vaccination. They got COVID positive there, became cases, got sick, but they recovered. Excuse me. So as we are moving into our community, school openings, and trying to find how we can protect with the lessons which we learned last year, adding to the vaccination, increasing the vaccination. We don't need to abandon symptom checks, and if you are having sniffles and all, make sure you get tested. That is an important part of the conversation we all need to have. As far as the third dose, which is becoming a very important part for immunocompromised, I just want to clarify there is a difference between third dose and booster dose. Third dose is the one in the series of what we call primary vaccination. For example, if the best example you can take is hepatitis B vaccine, which gets 3 dosage, 0, 1, and 6 months. That's a series. While we sing of the booster you get after 10 years of tetanus or DTaP, whatever, the pertussis one. So they are the boosters because the immunity have waned down at that point. So the primary series vaccination with third dose for this one has been recommended, has been approved by FDA and accepted by CDC director. The third dose should be given to the immunocompromised people who have certain conditions, you probably have all seen active or recent treatment for solid tumors and hematological malignancy, it's like a blood-borne malignancy, who are recipient of solid organ or the stem cell or the hematopoietic stem cell transplant. Severe primary immunodeficiency, it means people are born with that. There are different conditions, Wiskott-Aldrich syndrome and DiGeorge syndrome, there are a list of them. Untreated or advanced HIV infection. Active treatment with the high doses of steroids, mean 20 milligram steroids for some time. That will be because usually you start with a higher dose, and a lot of those treatments are given to initiate either chemotherapy or initiate in terms of the transplant and different ones. There are different reasons. And also the people who are under treatment for rheumatological conditions, they get into some of the very strong immunosuppressive medications, because in all those situations, your own body is seeing your body itself is an enemy and trying to attack it, and that's what the immunosuppressant agent do when people on transplant are put on those medication. And then something like called spleen. I think we all have spleen. Spleen protects a lot of infection. And then chronic renal disease. However, it does not cover for those who have something like heart disease at this point, or diabetes, or people are in nursing home who may not qualify for these conditions, or elderly at this point. Would they qualify for booster dose later on? So the booster dose is a very different concept. Booster is that when the immunity is waning down after a certain time. So what we have seen from the CDC data at this point, at 6 months, both Pfizer and Moderna had shown their immunity, their protection is pretty fair at this point, 91 to 93%. However, it might change as they continue to look into these studies. So it is very important to keep that in mind. It's not that how come they didn't say that before. As the studies are going with this ongoing pandemic, the CDC, FDA and CDC is looking at these data very carefully and continue to provide that guidance. So in a way, it's a fluid situation. So right now we are at stage where there is a third dose of vaccine for mRNA vaccine, Pfizer or Moderna, not Johnson & Johnson at this point. That is in the works in progress with the CDC and FDA. Right now, they are not the one who can get the third dose. Those people who have gotten either Pfizer or Moderna would be able to qualify. What I would ask to everyone, if you have those conditions, if you have any questions, please pick up the phone and talk to your doctor, whether you will qualify for those third doses at this point, because if you have a history of 10 years ago, or if you have a history of cancer 20 years ago and you are okay, that's what it's not clear. So some of those things we are looking for some clarification from CDC as well at this point. However, there are very clear indication. If you have a transplant, what I would ask is that talk to your transplant doctor, because what my concern is in certain situation, if people have a prior history of sort of what we call rejection or history of rejection, they might react differently. It doesn't mean they can't get it, but their doctor needs to really weigh into that you are really ready to go. And I would strongly encourage everybody who qualifies in under these conditions to talk to their doctor and get the shot as soon as possible. How can you get the shot? That's the question I think we have to also discuss. I have been in conversation with the local colleagues and trying to see at this point, do they have capacity to do that? Learning from last several months, when many of the physician practices have been very comfortable doing both Pfizer and Moderna, I do believe they should be able to vaccinate their own patients, because they are there, they are coming for their follow-ups, and they will have the vaccine. We certainly can give them vaccine. They can get the vaccine directly from the state, and that is a very safe place for them to do. Can we do that in our clinic? Of course, we are there for everybody. It goes without saying. We certainly are going to do that, but I would like our physician colleague to step up and be a partner in there. So if they have the patients who they feel they qualify, they can request either Pfizer or Moderna from us or from the state. We'll transfer them within less than 24 hours. Within few hours, actually, we can transfer them. It's a very simple, straightforward process, and it's a very doable. We certainly can do, and there will be more to come. So thank you.
Questions?
Brian, could you give a little clarification on your executive orders? In the schools, you're mandating vaccination or testing for staff. You're not mandating masks for everyone, even though you've advised that?
My understanding is we gave guidance to the districts, and my understanding is that the districts are going to follow the guidance. So certainly if it got to a point that the situation on the ground continues to be where it is today, and some districts were not following the guidance, we would then look at mandates. But we speak to the superintendents all the time, and we spoke to them this morning, and I think they valued the guidance we gave and the direction we gave. Again, if this was June, Tim, the masking would be a different issue. But with what we have now, it's pretty clear there's a risk to in-person learning if you don't have the mask on, related to transmission, but probably quarantine is a huge risk as well if you get, for a whole class to be put in a remote setting again. And the remote settings just didn't work very well. We know that.
And on the daycare side, you're mandating masks, but not the vaccination and or test?
Correct. So part of with the vax or test, and again, with our own workforce, we're likely to do a vax or test policy in short order, but I'm not going to put out a mandate if I don't have the ability to deliver the infrastructure with it, right? So if we don't have the testing available to a segment, we're not going to say you have to go do it, but then good luck finding a test, right? So with schools, we have a robust testing program. We've received funding for that. We're partnering with the districts, not an issue. We are building up our testing infrastructure in the community again to meet the challenge at hand. Again, for our own employees, likely not to be an issue, but as soon as we have it ready, I can pull that trigger. But what we learned during this, and again, when the state would make mandates and then just say, go do it, counties, and we had no ability to do it, that's not partnership and that's not reality. So we want partners and we want to live in reality. So anytime we look at a mandate, we're going to, if I'm issuing it, we're going to have the ability to deliver on it, or else I'm not going to issue it.
Have you talked to school districts? Was this something that they wanted as well, this mandate?
We speak to the school districts all the time. We've spoken to the superintendents multiple times. This was something that we felt very strongly about, uniformity across the board to prevent mitigate all risk possible so that our kids can get back and have a regular school year.
So masking in daycares, is that for the children and the staff, or just the staff?
We're going to start out with just the staff. We might expand on the order, though.
Do you have any sense of how many teachers are vaccinated in the county? I mean, is it most or?
Yeah, my guess is it probably follows on the same lines that all the data does, right? So you're probably looking at somewhere between 70 and 80%. I think over 18, we're at 77, approaching 78% of our population. So I think when you look at every industry, I think there's a couple industries that are lagging, but most of the industries are probably in that range.
Can you expand? Earlier you said that people should be wearing masks indoors. People don't need the government to be telling them to do that. And you're not issuing a mandate, but why?
Yeah, because we can't enforce a mandate, Adrian. That's so. And again, you look at for me to issue that mandate, that means I'll have to rearrange county government where I can actually enforce it. And based off of the hospital numbers today, that's a decision I'm not comfortable making because the hospital numbers don't merit that. But again, it's very, you don't need government-issued mandates to understand if you're going to a grocery store where there might be 100 or so people, that you should probably be wearing a mask at this point. If we get to the point where things progress, you'll see more targeted surgical mandates. You won't see broad-based mandates until our hospital infrastructure is at a point where 2-3 weeks, we'll be in real trouble on that trajectory. That's not where we are, though. And I think that's important for people to find balance. We have a situation that's serious. We have to take it very serious. We know what works and what doesn't work, but it's not a situation where we should be panicking.
But
What are the hospital numbers today, Ryan? They've been going up pretty steadily.
Yeah, we haven't seen them yet. One of the things that led to the weekend hospital numbers is, as you know, we had a rollover crash where we had multiple people going to the hospital. Oftentimes when you have people go in the hospital for other things, they test you for COVID and you could be an asymptomatic positive. We had cases out of that crash that were COVID positive. And so but we'll see today. Today's a good barometer when Dr. Gupta gets the data points out. But usually the first two waves, the active cases were somewhere between 12 to 15% hospital numbers based off of that. They have been lagging percentage-wise a lot less, which is the vaccine's effectiveness in our opinion. But we watch that closely. We speak to the hospitals every day, and that's part of our process. Because again, you could have a situation where your COVID numbers are okay, but everything else in the community is on fire. And then your capacities hit that way too. Then you got to look at other options. But this isn't something that we take lightly. We've learned through 18 months of this. We've been doing this every day, and we understand the the need to find balance, especially in my role, right? You have all these various interests that can all be impacted based off of decisions that we make. So that's why they're data-driven. They're driven by good information and good advice of the health department. They're driven based off of the hospital and hospital and ICU rates. Again, people need to understand this, and I'm very comfortable saying this. In my opinion, as somebody who's been doing this now every day for 18 straight months, I think Dr. Gupta would probably agree that this is likely to be an endemic. COVID's not going to zero, probably in my next term here as county executive. So the game isn't zero anymore. The game is learning how to live with this, protecting our medical infrastructure, protecting our vulnerable, and getting this curve flattened again. That's the goal. Zero is not the goal. That's probably unlikely.
So if the infection rate isn't the metric anymore to measure the pandemic, what numbers do you look at?
Hospitals.
That's all you're looking at.
No,
That's what makes you worried.
No, you have to watch cases too, because if your new case number, active case number, say it's not 12 to 15% as a lagger, but it's 6 to 8%, somewhere in there, you got to forecast out. But the most important thing is our hospitals, just like it was in the second phase. The second phase, remember, our first phase, our high case day, and we had the economy shut down, was 65 cases, right? 65, and we had the economy shut down. Why? You look back and say, why did we do that? Because we didn't know any better. We're learning about this, right? Second phase, we had 500 cases in a day, 500, and everything was still open because we learned how to live with it. Now we're not anywhere close to that, and because of the vaccine, it's likely we won't get there if we're smart. But we got to find the balance. And unlike some of the things with the state in the past, the state said a lot of things, and they would say a lot of things. Then they say, governments go enforce it. And we didn't have the ability to enforce it. And I'm going to be honest with people. I'm not going to put out mandates there that never get enforced and expect expectations until we have to. And that goes for the broad-based countywide mandate. One, the hospital data doesn't merit it. Two, for me to do that and enforce that, that means police officers have to buy in. It means instead of responding to crime there, they have to be able to respond to mask wearing. Is that the best use of their time? It means I have to rearrange county government to have people doing different things. That's what a mandate looks like, something you have to enforce, or else it's not taken seriously.
So do you think it's smart to have a state fair here with 100% capacity right now?
I think at the state fair, look what we've done. We're learning to live with the virus, right? There's a mask mandate indoors, where the most risk would be for the spread of the virus. There's testing that's being done on most of the staff that's being there in the beginning, that's going to be there for the full 18 days. There's testing available and vaccinations available. Certainly, everybody going there has a perspective on how to keep themselves safe as well. So what else do you want to do? I guess would be the question related to the state fair and putting the proper protocols in place. And that's practical, right? So I think, again, if this is an endemic, we got to learn how to live with this, right? And
do you have any contingency plans? Is there a way to monitor whether you're seeing cases from the fair and maybe you would limit attendance or something like that if?
Yeah, I think Dr. Gupta and her team, they do contact tracing, right? And if they find a massive cluster from something and there's data to support what are now assumptions, then that changes everything, right? And then you can look at it specifically. But we worked really hard to get our lives back and get things going. And we still got a lot more work to do with the vaccinations. And basically, we need people to get vaccinated now that are likely not to have the same mindset as everybody else who's already been vaccinated in this. So there's a balance we have to meet with that. And shutting down things based off of assumptions and not data does not help with that cause.
County Executive, pot
at the New York State Fair, smoking weed at the New York State
Yeah.
Fair. You're a dad, you have children. How do you feel about that?
Yeah, I don't think it's a good idea. It's not my call, but certainly you won't see me getting high at the New York State Fair. And I get it's legal, but it's just, again, this was going to happen at some point, right? It's been legal new, so I mean, I guess this is when it starts, right? But it's certainly something that I don't think is as family friendly, but at some point, who knows what it will be like down the road.
Talk as a dad. How would you, do you feel other parents should be, concerned? I mean, you already said pot should not be at the New York State Fair in your opinion, but how does that make you feel bringing your kids to the State Fair?
We're going to go. If there's somebody smoking pot, we'll probably take a right or a left, right? So that's what we'll do. But, the McMahon kids will have that experience. But hopefully they won't have the experience of running into marijuana at the New York State Fair. But it's a legal substance now, so this is part of that process too, I guess.
And what do you say to those people that will be maybe lighting up at the New York State Fair? Maybe your recommendation?
I think it would be better if they didn't, but they're legally, the State Fair said it's okay, then it's okay.
County executive, staying on top of the New York State Fair, we've spoken with medical experts, including Dr. Thomas, and last night he said he's not bringing his children. So that's coming from a medical expert. So what is your encouragement for everyone else in the county?
Yeah, people make their own decisions, right? And again, I'll bring my kids, and I'll do what I know is best to keep them safe.
But is there concern that this is going to be a super spreader? We're hearing that 1 million people are still coming to our area in central New York for the fair.
Yeah, I don't think 1 million people are coming from out of the area to the fair. I
Over
think
the course of the 18 days.
that's 1 million people, but not from out of the area. So I think there's risk when you have an open community. We have travel cases every day. That there's a level of risk. You do what you can to mitigate that risk. I think we've done that. Again, I'm not going to panic for an event based off of assumptions. We've taken extra precautions and extra regulations in that. Again, if Dr. Gupta can bring us contact tracing data and on day 7 or day 8 of the fair and say, look what happened here, then I think we got to look at what the data is telling us and what we can do to address the situation. But everything else right now is an assumption. Yep.
So for case investigation, contact tracing, we have been working with the New York State Department of Health very closely regarding the whole thing and coming up with the plan. Our team is working with them, had conference calls with them. Because they're multi-county, it's not only our county, so the people come from different counties here. So yes, we will have county residents who are going, but state is a centralized, state's contact tracing work from their Bureau of Disease Control will be overseeing all that and working with the multi-county jurisdiction. So rest assured, there are a lot of things which continue to happen in the background which you don't know. I just want to make sure that when they are going to be testing their staff or the people, whoever, the numbers will continue to come and they will send them to appropriate counties, and we will continue to do contact tracing and continue to relate with that. I think that's something should reassure you all. Thank you.
Dr. Gupta, the contact tracing had been an issue for a while. Are you getting more cooperation now, and do you expect to get cooperation?
So it's a mixed bag, right? A lot of times is when people, our New York State case investigators do majority of the work in terms of that, then we do the follow-up with them. Many of the people don't pick up the phone, they don't want to respond, and when they, after repeated attempts, we actually send letters. We have sent, if we are very concerned, we'll even send a person in certain situation if we are going to think this person is going to be spreading to too many people. There is a less response by people, so I would ask everybody to pick up the phone if they see the New York State, like a case investigator number, and they should respond to them, and then they should respond to when our staff calls to give this information. It's not a punishment to anybody. Things happen, life happens. And if they become a case or if they are a contact, if they are unvaccinated, they are going to be in quarantine for 10 days. And if they are vaccinated, they are not going to be in quarantine for 10 days. That is an important distinction. So it's ongoing conversation with them and making sure that they comply and they respond to our request of the New York State contact tracers request to participate in the conversation. And as I see in many sheets, when I see that at the end of the day, many people do actually respond. Some of them who are not going to be compliant, and we pretty much continue to repeatedly go after them. So it's a tedious work, it's a complicated work. It has become a little bit more difficult than it was last year because people want to just go about their business. But I think in good faith, a lot of people do respond to us, but those who percentage don't, we continue to go after them. And
Last year, the contact tracing process was delayed often by a week or more, and is that going to
no, so
within the time frame of the
yeah, so we actually get it very timely. The same ComCare system, electronic case management system by the state, is still in the play, and we get in a real time every day data. So if we reported whatever the case is yesterday was, that will come a day before, and we investigate them and report them that completed. That's how you get the analysis, how many were household contacts and all those. What delay happens is that when people don't respond, those people keep on pushed, and they keep on not appearing in our staff's radar because we can't reach them. It's not that people didn't do the effort, but the case reports come in a real time to us in a very efficient way, actually. That has been very important for all of us to do, especially when it involves businesses, when it involves any other workplaces, that we are able to do investigation pretty effectively in a very timely manner. Yeah.
Doctor, do we have the highest rate of transmission, or one of the highest in New York State right now?
So, yeah, so the rate of transmission, the way it's calculated by the cases per 100,000 population. So we are in that transmission zone, which is called the highest one. But you know, these are data is very relative. So when you are looking for going from high to substantial, there's a number difference from 50 to 99 per 100,000. When you reach 100 to 150, that becomes 100 and above. That becomes high transmission. The theme I think people need to remember, when we have many cases coming, and we know the transmission is happening, those data points are important, but our focus should be how can do mitigation, right? Mask wearing, physical distancing, testing, vaccination, all these things are very important to bring the caseload down. So that is important.
Is the opportunity for testing for people right now, what advice do you have for them? Because we've seen a drawdown in testing as this has gone out. Is this the time to start ramping up testing? And does the county have enough resources right now to support that?
Right, so I will just say a few words, and then county executive will continue what in terms of the plan is for the community testing. So right now we are seeing people are being tested. That's why you're seeing the cases are going up. Otherwise it won't happen. Many of them symptomatic, and if they are contact of a case, one of the guidance which we have provided, if you see into our guidance in terms of when to quarantine people, if you are vaccinated, if you are exposed, you don't have to be quarantined, but we recommend them in 3 to 5 days get tested, because you might be having asymptomatic infection. You are not going to be in quarantine by us, by commissioner's order. However, if you are symptomatic, as you saw, the county executive put the executive order a few days ago, that if you're symptomatic, even though you're vaccinated, you are going to go for tests and stay in quarantine by his order to make sure you're not positive. So there are many ways to protect people are going, so we are encouraging people to get tested if they're exposed, to pick up those people who are asymptomatic earlier so that that can reduce the transmission in the community.
I think, John, one of the things so basically every county in the state, with the exception I think of 2, now meets certain CDC new case thresholds for what they would consider high transmission. Part of, again, I spoke to this a little bit earlier, but I think it's just reiterating. Okay, so yesterday, right, there was the Central New York region from a positive rate was maybe 6.3%. There's very little testing, right? So to Dr. Gupta, what she just described, what that meant was people who were sick got tested, and the people who are direct contacts, right, likely to have it, got tested. The Finger Lakes was at 6.2. The Southern Tier, I think, was at like 6.4, right? So I think there was a media headline that like we were the highest in the state, sure, for one day. So there's going to be a headline when we're not the highest in the state today, right? So I think you take everything in balance. The reality is we are building out that testing infrastructure, community testing twice a week now. Part of building that up again means some of the emergency orders that allowed us to have different people doing different things in the pandemic. We don't have those tools available anymore right now, so building it up means doing different things. But as you see more testing, you're going to see more cases, and that's good, because that means we're really actually identifying the virus and isolating it and eliminating that risk. But that's the best tool we have in the first 2 phases of this was our testing strategies and our programs with the isolation and then the quarantines and building up that infrastructure and with the physical distancing, et cetera. Now we got the vaccine too. So we have a better tool as well, and this is going to be a wave, and it will start coming down from it at some point here, and then we got to be ready for what happens next. Is we can't get too high and we can't get too low with this.
Staying on the...
Sorry, you mentioned the tour bus. Has that, those instances, those cases, has that started or changed the conversation with some of these tour companies?
No.
Guidelines for that?
Yeah, we're not going to get into the micromanaging of that, because we have people go into hospitals every day that are asymptomatic, they test positive, and then they're in there getting a procedure. As soon as their procedure's done, they go home. So that's a hospital case, by the way. That's one of those, even if you're not in COVID, you're not in the hospital for COVID, but you test positive and you're in the hospital, you're a hospital case. But yeah, we don't have tour bus rollovers every day in the county. Putting any policy to address that at this point doesn't make a lot of sense.
County Executive.
Guidelines for those tour companies requiring, some of these guidelines that you have in place as far as masking or possibly testing.
I don't even know if there's any tour company like that's corporately headquartered here in the county. Again, if we saw this, the data showed us that this was an ongoing issue, then we would look at that.
Can you confirm how many...
Delta variant goes in kids. We see across the country it has not been a good summer for kids. As far as cases here relative to Delta or COVID this summer, are you happy where that is? And also, secondary, as a father to the community, I hear you saying that we should do the responsible thing when we head indoors. Let's remember our kids in the community don't just go to school, they go to grocery stores, they go to other
Right.
places where people are and could potentially pick up the virus, right?
Correct. Yeah, I think the best thing that as parents you can do is get vaccinated. That's where most of these cases happen with the younger children, and they haven't had the opportunity to get the vaccine yet. So that's one thing you can do. But also, we know best practices with kids. I know certainly in a crowded indoor setting, having the kids in masks is appropriate, and we know that as parents. I know some people disagree with that, but I think for the majority of people, we understand that, and people should be taking those precautions at this point.
Can,
What do you say to the people who walk into stores right now without masks? You don't want to mandate it, but you highly suggest
Yeah, we recommend the caseloads now are probably, today's less than it was yesterday, but you're looking at daily cases that will probably I'll go out on a limb and say between 70 and 110 cases now, where we are for this upcoming week. That's worthy of taking more precautions than when cases were 20 to 30 cases a day, right? So that's something that we know, it's risk mitigation. People will talk about what kind of mask, and you're right. Certain masks are a lot better than others. Some masks protect you and everybody else. Some masks just protect everybody else. But that level of mitigation is a tool that we have at our disposal, and it should be taken seriously at this point.
County Executive,
You've been a big proponent of vaccinations as the solution. So can you talk a little bit about the fact that 40% now of the new cases you're seeing recently are among
Right.
vaccinated people? Are any of them going to the hospital? Are they passing
Yeah.
the virus to others around them in the family? Put some.
Yes, so I think, to your point, it's right, but I think the data is a little manipulated because we have a high vaccinated community. So, yeah, well, we have almost 301,000 people going into today that have received the vaccine, right? So the Delta goes at you different, right? It's more contagious, so they're going to get to certain vaccinated populations. So over the last few days, really few weeks, you've seen the percentages be that 30 to 40% vaccinated with new cases. But the other trends that you're seeing is, have there been hospitalizations? Yes, there have. I don't believe we've lost anybody. And out of the hospitalizations, I think there's a trend that many of these people may be your immunocompromised vaccinations. Not saying others haven't been. But the vaccine is still the tool that, A, for the most part, helps prevent you from getting the virus. B, certainly helps you from going to the hospital. And C, protects your life better than not having the vaccine. So it's the best tool we have to protect ourselves in this pandemic. Is it a perfect tool? No, but we never thought it would be. These are 95% efficacy vaccines or 75% efficacy vaccines. That's a lot better than zero. And so that's why folks need to keep getting it and getting that shot.
County Executive, can you confirm how many?
How many of the hospital patients over some time period have been vaccinated? Do you have those?
We can look at that. I think each day, if you have an info, you might have one or two vaccinated hospitalizations. The challenge is people are getting out of the hospital so fast more. That's part of why the infrastructure is there. They're going in, it seems that some of the data is suggesting the discharges are happening faster as well. So not to say they aren't as sick, they're going to the hospital. But we'll get new ones each day, and we'll identify those, but we don't know when they get discharged specifically. So that's a tough data point, but we can try to tackle it. Adrian.
That was Abby.
Oh, Abby, who's, I hear it all, okay,
I know
all
it's
right.
coming from all the.
It's the mask.
Okay.
Thank you. How many positive cases can you confirm came from that bus crash?
I don't have the number. I know that there were at least one.
County Executive, do you think that employees for vendors coming to the state fair should mandate their employees to wear masks, or can you mandate that at all? Or do you think that that should be a recommendation for employees, for vendors to wear masks?
Good question. If you're indoors, you have to wear a mask. If you're outdoors, I believe you don't have to, but they may have policy. I'm not sure what the state fair policy is. I know most of these folks are getting tested.
Question about testing. Just with going back to school and the fair right around the corner, 4 days away, people are probably going to want to get tested if they go, maybe have the sniffles after. They're going to want that opportunity to test. And I know the county is planning on ramping up that infrastructure, but are there any plans,
Sure.
places that people should know about ahead of time?
Yeah, I think urgent cares have opened up, and they're going to be doing more asymptomatic testing as well. And so certainly the same testing at your doctor's offices that have provided that, certainly you don't want to send people to the hospital, but I know community does testing as well. So there's ample testing in the community. It's just folks haven't been so much. If you were I think there for a while there, before Delta, we thought if we were vaccinated, we don't got to worry about getting a test if we get a certain ailment. And now we just aren't afforded that luxury, right? If you get, even if you're vaccinated, if you have symptoms, you have to get a test.
Circling back to daycares, I know you said that this mandate for masks is among staffers, but we've seen that the Delta variant has impacted children, so why not impose that? And also with schools, I know you said with the mandate and the executive order today, it's either that opportunity to test or show proof of vaccination among the staffers, but is there anything that's going to come with kids other than suggested guidance when it comes to mask wearing?
Yeah, so the part of this is because these adults are going to be working with children that haven't had the opportunity to get vaccinated. That's the logic there. I'm very hesitant to talk about vaccine mandates with people's children. But this is if you're an adult, you're going to be working with people that haven't had the opportunity to get vaccinated, and certainly you're going to, if you're not vaccinated yourself, then you need to get a test. That's
I meant the mandate among mask wearing for kids in schools and daycares.
There's no reason for me to do a mandate right now for schools because the superintendents are taking the guidance. And again, if they didn't take the guidance, then you got to look at that as a decision.
Can you clarify that the suggested guidance right now for superintendents in schools is that kids mask up?
Absolutely. That's in the document. Yep.
With a greater reliance, Ryan, on testing or on proof of vaccination, have you heard any stories about people making up their vaccine cards, fake cards, and stuff like that?
I haven't heard of that locally. I'm sure to a level it exists. And again, I think New York City is going through a process where they're mandating some of this on their private sector businesses. So they'll be the first one to try to do this and try to enforce it. Certainly communities will learn from what they're doing. But you hear about it from a macro level. I haven't heard about it being an issue here.
If the fair ride as it goes along presents itself with a lot of, an increase of COVID cases that you can trace back to the fair, I know that the fair is within Onondaga County on state land, but does the county have any, flexibility to show its powers in mandating some changes if they need to be made?
Yeah, so if we find data, we'll call, that's concerning, I'll call incoming Governor Hochul and we'll have a conversation. That's what we'll do.
And as far as you were talking about, we're learning to live with the virus. We kind of have an imperfect storm brewing right now with potentially a million people coming to town or from...
Remember, there's not a million people coming to town. If there's a million people coming to town, we'd have about 2 million people at the fair.
Well, they don't
there's
come
people
just...
coming. There's people coming, but not a million.
They don't come just from Syracuse, we know that. They come from all over, you know what I meant. As far as it goes, if there is an uptick of COVID cases, I understand that, some hospitals are very busy right now. Can't imagine what that might look into the future. Would there be anything that you would be looking at in terms of if you had to partially shut things down again or anything like that?
Yeah, again, these are way, way, way hypotheticals, right? And so the only way you shut down things are you talking about the event itself, or are you talking, again, the event itself, if there's a challenge, I'll talk to the incoming governor and we'll have a discussion about what we're seeing and then we'll make a decision together. But the community itself, to get to where the hospitalizations were when we actually had to consider these things back in January, you would probably need to see north of 500 cases a day. And again, if that's where this goes, then there'll be very serious conversations. If that's where this goes, there'll be more mitigation before we get there, based off of what will then be very clear data. But that's, that's probably, I would say that's unlikely that this goes there, based off of what has happened with this Delta in the UK and other parts of the country. Now you're seeing how long it kind of gets there, and then it starts to come here. The question is, does it come all the way down, or does it kind of stay halfway through the hill or not? In the UK, it's come right here, and it's kind of stayed right here. It didn't come all the way back down like we've seen previous waves.
There are parts of the U.S. where it certainly has spiked to problematic levels. Do you think we're so much better vaccinated that that won't happen here?
Yeah, if you look at Mississippi, Arkansas, some of these states that have had those challenges, I think 20 percentage points, if not higher, from vaccination rates. That's a lot when you look at total population. And so, we need to keep vaccinating, but that's got to be the difference, right? I mean, that's got to be the difference between it. Just like when, we saw those cases in January and February at that very, very high level, we started vaccinating, right? And then your nursing home cases started to go away. And then your seniors started to go away. And then each demographic that got vaccinated more, you saw those cases going away. What kind of changed the game is the Delta, right? It's a different virus.
And County Executive, back to the fair, would you consider mandating masks for out-of-state vendors?
Yeah, I think you got to talk about what's enforceable. We're not going to know that, right? We would have to talk about it, and we'd have to have a reason to do it. Again, if they're indoors, they got to wear a mask. Last question. Anybody?
Reed, you sound kind of relieved that the state mandates are not as heavy now. Is the state health department and the state government, are they like AWOL now in this virus, or do you feel like you're getting the support you need from the state?
Yeah, so the County Executives Association's already spoken to the incoming governor, and we'll continue to have conversations. We're working collectively on guidance to give to other counties based off of all the factors we've talked about that we're seeing. And everybody obviously is in consultation with their own health departments. But this has kind of been, this fight in New York State's been uneven, right? At times it's been a real problem in downstate New York and the Hudson Valley, then it comes up here, and then it's not a problem there. And so regional decision making, there's value in that. Then there's some decisions that really should be based off the state level. And again, I think we've asked throughout this pandemic at the county executive level for local control. This is what we're elected to do, and we kind of have that now. So we're communicating, we're talking to the incoming administration, and working through that. We put out guidance in the absence of some state leadership related to schools, and the state education put out guidance too, but your local health department did as well. But I think we'll have a good working relationship as it comes to response to the pandemic with the incoming governor. Thank you.